Welcome to section 53 of bacteria. In this section, we'll be discussing several miscellaneous organisms. Let's get started. This table contains several bacteria. These bacteria are important to know since they're tested on step 1. However, there's not much to know about each one. With that in mind, we wanted to create a table consolidating all the details that you do need to know. And this information is here for your reference, but this presentation will be spent helping you memorize these organisms and the pertinent details associated with each one. So let's dive into that. This story takes place in the yard of a quaint little neighborhood. We will start over here to the left where we can see a strikingly darker and more blue color scheme. We like to use blue colors to represent gram-positive organisms, and we use red colors to represent gram-negative organisms. These symbols will be reviewed again and again as you go throughout our bacteria lectures. Anyways, on this left side of the image, we see blue. So you should remember that the organisms over here are gram-positive. Now let's bring on our first characters. Notice this guy is stealing some trinkets from this old house here. Fortunately, the owner is sitting out here in the front yard, and when this guy comes out, this old man has his trusty whip. He's so good that he can whip people's eyes out, which apparently he has no moral objection to doing. So let's zoom in to see this better. Look at that guy whip his eye out. Eyeballs just coming out and everything. It's disgusting and sad. But whip eye sounds like whipplei, as in Tropheryma whipplei. This pathogen causes Whipple disease, so whip eye for Tropheryma whipplei. If you look closely, you can see the trinkets this man was stealing were these little weird collectible marbles. These represent PAS-positive granules, which is a stain used to biopsy and confirm the presence of Whipple disease in the intestines. This image shows an intestinal biopsy taken from a patient with Whipple disease. Tropheryma whipplei infects intestinal mucosa. The layers of intestinal mucosa are covered in great detail within the GI anatomy chapter. For now, just know that there's the epithelium, and deep to that is the lamina propria. And right here, we can see the lamina propria. Here in the lamina propria are macrophages, which have phagocytosed many Tropheryma whipplei organisms. Now this is where the stain comes in. Tropheryma whipplei has glycoproteins in its cell wall, and the periodic acid-Schiff stain will bind these glycoproteins. And that's what gives this biopsy that purple appearance. There's more to know about Whipple disease, but this is more appropriately discussed in pathology. Right now, just know that Tropheryma whipplei will stain positive for periodic acid-Schiff. So again, the whipped eye kid carrying the little purple balls represents the purple color created by the PAS-positive stains on intestinal biopsy. Notice that this old man is actually lacking toes. Let's zoom in on that to see it better. Poor old man must have been through some battles or something. All he has left is that pinky toe. Anyways, he lacks toes, which sounds like Lactobacillus. Lactobacillus is part of the normal vaginal flora, and the man lacking toes has hired this man to spray potent antibiotics on his property to kill all these plants. Because you see, the lacto man wanted to clear out a special space in his yard, but he struggles to do any chores himself because he lacks toes. Anyways, the antibiotics killing the plants near this lacto man should help you remember that antibiotics can reduce the population of Lactobacillus. And when the colonization of Lactobacillus is reduced, other organisms can overgrow and cause a vaginal infection. And the reason this lacto man wanted to have some space cleared out in his yard was so he could plant a flag from his native country of Canada. Well, Canada represents candidal infections of the vagina. So when the population size of Lactobacillus is decreased, organisms such as Candida albicans can grow and cause infection. So cleared out space next to the Lactobacillus man represents decreased Lactobacillus population leading to vaginal candidiasis. A decreased population of Lactobacillus in the vagina can also increase the risk of other organisms such as Gardnerella vaginalis, which causes bacterial vaginosis. To help you remember this, we have this garden overgrowing in this area. These garden plants are resistant to that potent antibiotic. So you can see that with all this cleared out space, these garden plants grow really well, and they aren't even harmed by those chemicals. So again, decreased Lactobacillus population can increase the risk of Gardnerella vaginalis or vaginal candidiasis. Next, we can see this man making a strange concoction. It turns out that this neighborhood is experiencing quite a bit of turmoil at the moment, and there's a little bit of street warfare going on. This man, in an attempt to defend his home, is actually using Pepto-Bismol to make some explosive materials. Look at it clearly labeled, Pepto-Bismol. This Pepto-Bismol represents Peptostreptococcus. Peptostreptococcus is an anaerobic organism. Our recurring symbol for anaerobic organisms is a mask covering the mouth. Notice it's covering up the mouth and the nose, the places from which we bring in oxygen. And covering up these areas symbolizes the lack of oxygen or that this organism does not need oxygen. So mask for anaerobe. If you look closely, you can see this man is actually making a Molotov cocktail, an explosive weapon made from alcohol. This alcoholic weapon represents alcoholic aspiration. Peptostreptococcus is an anaerobe that's known to be aspirated and cause lung infections. And alcoholic aspiration refers to alcoholics where they accidentally inhale organisms and other things that should go through the GI tract but instead go to their lungs and cause infection. So again, alcoholic weapon stands for alcoholic aspiration. And the fact that this alcoholic concoction is spilling out of the bottle in areas it shouldn't go will help reinforce the fact that in alcoholic aspiration, fluid goes into the lungs where it shouldn't go. The last detail to know about Peptostreptococcus is that it is often associated with Decubitus ulcers. So when patients sit on a joint or lay in a hospital bed for too long without moving, they can develop what are called Decubitus ulcers, basically pressure ulcers. Anyways, this Pepto-Bismol/alcoholic concoction is spilling over the sides of the table and has caused a cube-like patch of dead grass. In fact, it looks like there's 3 of those dead patches, kind of making an ulcer there in the grass. Anyways, this cube-shaped ulcer should help you remember Decubitus ulcers, which again can be caused by Peptostreptococcus. As part of his apparatus, he uses these tubes to funnel in the Pepto-Bismol and alcohol. These tubes kind of resemble surgical tube drains. And this is to help you remember that Peptostreptococcus often infects surgical tube drains. Now let's move on to this part of the image. As you can see, this is filled with red, warm colors. This will help you remember that the organisms over here are gram-negative. Notice how someone on this side of the line is lighting the end of a long fuse. This fuse represents Fusobacterium. Fusobacterium is anaerobic, just like our Peptostreptococcus man. This man has one of those mouth guards, mask for anaerobe. And this man over here has also found that surgical tubing is an excellent way to help mix these Molotov cocktails. So these tubes next to this man lighting the fuse will help you remember that Fusobacterium often causes infections of surgical wound drains. And the man lighting the fuse is making what? More alcoholic weapons. Once again, these Molotov cocktails will help you remember that Fusobacterium is an organism known to infect the lungs in cases of alcoholic aspiration. It looks like all the mayhem and alcohol spilling everywhere has led to a bunch of dead ulcerated grass over here. Just like before, these take the shapes of cubes. These cubed ulcerations in the grass will help you remember that Fusobacterium can also cause Decubitus ulcers. Now this particular man loves his cheese and he produces it and sells it to make a living. And with all the chaos, robberies, and violence in the neighborhood, this man has had his entire supply of cheese stolen. Now that he's down to his last will of provolone cheese, he finds himself being overprotective and won't let it out of his sight. So he's carrying that provolone in his hand even while in the act of lighting that fuse. In fact, it's the loss of his provolone cheese supply that actually drove him to join this violent battle in the first place. Anyways, provolone cheese represents Prevotella, another gram-negative organism that's very similar to Fusobacterium. Just like Fusobacterium, Prevotella is anaerobic, and it's associated with Decubitus ulcers, and it's associated with alcoholic aspiration, and it can infect the tube drains from surgical wounds. So when you think of the man lighting this fuse with one hand and holding some provolone cheese in the other, remember that both Fusobacterium and Prevotella have the same traits. Now look at that box labeled fragile. I guess all those glass bottles in the box are considered fragile, so that label makes sense. Anyways, fragile box represents Bacteroides Fragilis. Bacteroides Fragilis shares almost all of the same characteristics as Prevotella and Fusobacterium. It's associated with Decubitus ulcers, it's associated with alcoholic aspiration, and it's associated with surgical drain infections. Now let's notice one more thing. The fragile box is partially covering the sewer drain, and there's flowers coming up out of that sewer drain. We like to use sewers to represent the colon. After all, the contents of the colon get emptied into sewers, and the flowers growing out from the sewer represent flora. So together, these ideas represent that Bacteroides Fragilis is part of the normal colonic flora. And since Bacteroides Fragilis is part of the normal colonic flora, it is often involved in intra-abdominal infections. To help you remember this detail, we have shown one of the Molotov cocktails exploding prematurely. I guess the box was fragile after all. Well, this unlucky fellow just happened to be in the way of this blast trajectory. Poor guy. Anyways, this blasting open of the man's abdomen due to the contents of the fragile box should help you remember that Bacteroides Fragilis is associated with intra-abdominal infections. If we go over here to this back corner, we can see that someone is actually having trouble with their water softener. It's not that the water softener itself is defective, but rather a bird is just poking holes all throughout it. Kind of strange that in this chaotic neighborhood, it's not a maniacal neighbor causing the problem, it's a little woodpecker making itself some bird holes. Mean little woodpecker. Anyways, when you say bird hole, it kind of sounds like Burkhold, as in Burkhorderia cepacia complex. So let's talk more about Burkhorderia. Burkhorderia is an organism that is known to cause lung infections in patients with cystic fibrosis. To help you remember cystic fibrosis, we like to use this water softener. The water softener represents cystic fibrosis because water softeners are filled with a ton of salt. And this reference to salt should make you think of a dysregulation of salt, which is at the heart of the pathophysiology of cystic fibrosis. So damaged water softener with salt spilling out represents cystic fibrosis. And Burkhorderia infects patients with cystic fibrosis. As part of this bird hole-related water softener malfunction, you can see all of this dust coming out and actually causing this man to cough. The poor guy's just trying to get rid of this bird and fix his water softener, but now he's just coughing hysterically. The coughing here is to help reinforce the idea of lung infections and pneumonia in cystic fibrosis patients who get Burkhorderia infections. Although the man is having trouble stopping the woodpecker, thankfully the man's little cat is ready to make its move and take out the bird itself. Cats are our recurring symbol for catalase positive. So whenever you see a cat in our bacterial images, think catalase positive. This shows a glass slide upon which the catalase test is performed. The details of this lab test are discussed in great detail in section 7 of the bacteria chapter when discussing Listeria. For now, just know that these bubbles indicate that this test is catalase positive. Next, we see this crooked salesman trying to sell people timeshares to the Bahamas. It's just a big scam. Look at that brochure he's holding. It says in big bold letters, Bahamas. Well, this represents baumannii, as in acinetobacter baumannii. Now, acinetobacter baumannii has some interesting features. The first being that it's catalase positive. To help you remember this, we see this man running away from this chaotic neighborhood and even being chased by this little cat, which seems to be biting his leg. I guess all the cats in the neighborhood are hungry at the moment. So cat biting the Bahamas timeshare salesman stands for acinetobacter baumannii being catalase positive. Now this man is running towards this car in an attempt to make a fast getaway. Unfortunately, the car is overheating and smoke is billowing out from the engine. This smoke is making our Bahamas salesman cough. This coughing represents the fact that acinetobacter baumannii causes pneumonia. If you look closely at the friend who is supposed to be driving the car, he has his laptop open. You see, these two guys had a sinister plan. The idea was that the salesman would sell phony timeshares to the Bahamas, while this hacker would hack into the Wi-Fi of these people and digitally steal any private information. They were going to use that information of ransom or blackmail. So these crooks were working together. Anyways, we use this hacker to represent Hasic organisms. Hasic is a unique acronym used for the following species: Haemophilus hemolyticus and Haemophilus parahemolyticus, Aggregatibacter, Cardiobacterium, Eikenella, and Kingella. So when you think of a hacker, think of Hasic, which is an acronym for these unique bacterial species. But what exactly do you need to know about these Hasic organisms? The significance of these Hasic organisms is that they are often associated with culture-negative endocarditis. So when someone has suspected endocarditis and you culture their serum but nothing shows up, these Hasic organisms are often the culprit. To help you remember this idea, we have this car. We like to use cars to represent cardiac issues, a recurring symbol throughout our mnemonic stories. If you look at the ground, there's a broken petri dish. I guess the people in this neighborhood were trying to grow some infectious organism to use as a biological weapon on their neighbors. In any case, when this hacker drove into the neighborhood, he ran over the petri dish and broke it. You can't culture something with a broken petri dish, so this broken petri dish represents culture negative. And bringing these ideas together, the car drove over the petri dish, so this represents endocarditis that is culture negative. Now it looks like the Bahamas timeshare crook is getting chased off by someone else in addition to the cat, the angry neighborhood granny. She wields this club for her protection, and she's a granny. Bringing these ideas together, we have Klebsiella Granulomatus. Klebsiella Granulomatus is common in Africa, not as much in the United States. For this reason, we have this club-wielding granny dressed in clothing reminiscent of Africa. Now this granny was minding her own business and butchering this cow when she noticed the crook salesman come along. This interruption was definitely not welcomed. Now we can see her in a fit of anger getting ready to throw a big slab of beef at the poor guy. Also notice a big piece of beef that stained her lap. Look at all that gross blood there. Anyways, the beef should make you think of a beefy red ulcer, and the stain on her crotch should make you think of a genital ulcer. So putting these ideas together should help you remember that Klebsiella Granulomatus causes beefy red genital ulcers. Here are two images showing Klebsiella Granulomatus ulcers, also called granuloma inguinale. The left image shows examples of these ulcers on a male. The right image shows an ulcer on a female. Despite how they look, these ulcers are actually painless. We want to help you remember that these nasty looking ulcers are painless by thinking about that stain on her lap. Having that beef blood on your lap and staining your African dress would be gross and irritating perhaps, but it wouldn't be painful. It's just a stain on your clothing. So Klebsiella Granulomatus ulcers are not painful, they are painless. And these beefy red ulcers are sexually transmitted. To help you remember sexual transmission, we have a large red S on this granny's shirt. This is a reference to the classic book called The Scarlet Letter, where a woman was accused of adultery and forced to wear a big red A on her shirt at all times to remind everyone she was an adulterer. Kind of an interesting, weird story. But we have adapted this sexual connotation and put a big red S on her shirt. So big red S for sexual transmission. Looking back at that dead cow, you can see she's about halfway through her work hand carving this body. Half is totally bloody, the other half is not. This dead body represents the bipolar Donovan bodies that are seen on biopsy. These Donovan bodies have a bipolar appearance just like this dead body. This is a biopsy from an ulcer showing those Donovan bodies. And these are located within phagocytes. And they are described as bipolar. As you can see, there's two bodies, separate from one another. And that's fairly consistent with all these Donovan bodies. These are often described as appearing like a safety pin. Not everything in this neighborhood is totally dangerous at the moment. In fact, right here is a harmless little swimming pool. Now this boy was already in the pool before, and he was surrounded by all those little rubber duckies. Those rubber duckies represent Haemophilus ducreyi, so ducky, ducreyi. And the mom was telling this boy to get out of the pool, but he didn't want to. Since he wouldn't get out, she started going in after him. In response to that, he jumped out of the pool and threw one of those rubber duckies at her mom. Look at that little toddler tantrum. I guess everyone in this neighborhood is overly acquainted with violence, even the little children. As you can see, this toddler has a strong throw, and that airborne ducky that hit his mom in the crotch was a pretty painful incident. Look at that mom wince in pain. Well, that wincing in pain represents that Haemophilus ducreyi causes painful genital ulcers. And of course, the hit was at her crotch, so this should help you think of the genitals. So again, Haemophilus ducreyi causes painful genital ulcers. If you look at the bottom of her bathing suit in the inguinal region, we can see these green bead decorations. These look like little lymph nodes, and their location draws attention to the inguinal lymph nodes. This should help you remember that Haemophilus ducreyi can cause inguinal lymphadenopathy, in addition to painful genital ulcers. And just like the granny, this mom wears a large red S on her bathing suit. She must have thought the S stood for swimming suit. She doesn't know she's broadcasting to everyone that she has an STI. But anyways, Haemophilus ducreyi is sexually transmitted. So red S for sexual transmission. Now look at some destruction taking place back here. This kid stole a TV from his neighbor and decided to urinate on it in a spirit of triumph. Well, urine and plasma represent ureaplasma, the last organism to discuss. You can see all that urine spilling and collecting on the ground. This urine represents urease positive. This is a recurring symbol, so when you see urine on the ground, think urease positive. The urease test is described in detail in section 16 of bacteria when we discuss staph epidermidis. Just know that on the left, you can see that pink color. That tells you that this organism is urease positive. Now, it looks like this kid received a little poetic justice. After all, when he urinated on the plasma TV, he received an electric shock, hurting his urethra. I guess he forgot to unplug the TV. Anyways, this pain in the urethra represents urethritis, one of the known consequences of a ureaplasma infection. The same shock that hurt his little urethra actually blasted the brick wall back here. I guess the fact that only his urethra was injured makes him pretty lucky, all things considered. Well, this broken wall represents the fact that ureaplasma doesn't have a cell wall. The cell wall is important for gram staining, and without it, the gram staining won't yield a gram-positive or a gram-negative result. And this ureaplasma child is straddling this line separating gram-negative and gram-positive organisms. This is to help reinforce the fact that ureaplasma won't stain gram-negative or positive. So we've covered the image now, which means we've covered all of the details within this table. So now let's review what you've learned with a question. A 45-year-old male with a history of alcoholism presents to the emergency department with a painful, productive cough. He reports that his symptoms began shortly after a visit to a local bar. Upon awakening, he discovered that he was face down in a puddle of beer. A radiograph of his chest is obtained, which is suggestive of lobar pneumonia. His sputum is cultured and a gram stain reveals a gram-negative bacillus. Which of the following is the most likely infectious organism? Burkhorderia cepacia complex, B. Tropheryma whipplei, C. Haemophilus ducreyi, D. Peptostreptococcus, or E. Fusobacterium. Hopefully from the question stem, you notice that this man experienced alcoholic aspiration. After all, he was face down in a puddle of beer, so we should be thinking about alcoholic aspiration. And he has a painful productive cough, and lobar pneumonia, so he has pneumonia. This scenario is consistent with aspirating alcohol and developing pneumonia as a result. We also learned that the organism is gram-negative. So which of the answer choices is a gram-negative organism that's often involved in alcoholic aspiration? That would be choice E, Fusobacterium. Recall from the image that Fusobacterium is over here, so it's gram-negative. And it's associated with these alcoholic Molotov cocktails. This is to help you remember alcoholic aspiration. Now choice A is incorrect because Burkhorderia really only occurs in cystic fibrosis patients, and we have no reason to believe that this 45-year-old man has cystic fibrosis. And choice B is wrong because Tropheryma whipplei causes Whipple disease, not aspiration pneumonia. Plus, it's a gram-positive organism. Remember that guy with the whipped eye? He is in the darker, bluer part of the image to help you think of gram-positive. And choice C is wrong because Haemophilus ducreyi causes painful genital ulcers. Remember that little kid throwing that ducky at his mom's groin? And lastly, choice D is wrong. Although Peptostreptococcus causes aspiration pneumonia, these species are gram-positive, not gram-negative. And that concludes this section.